Long leg X-ray. I think that is a very important preoperative or diagnostic tool. And I know this image maybe is a bit confusing in the beginning, but it is important to understand the different aspects of alignment. And you get all that information out of a good AP long leg X-ray. And then you measure different angles and you draw different lines. For example, you draw your mechanical line, which is from the center of the femoral head to the center of the ankle joint. And in a straight leg, it passes the intercondylar notch in the middle. In a varus knee, it passes the knee through the medial side. So it is then more here in that area. In severe varus knees, it passes the knee even medial to the knee. And in the valgus knee, of course, it's on the opposite side. Beside that mechanical axis, you also look at the anatomical angles. So as you see here, you draw the lines through the femoral shaft, through the tibia shaft, and to the femoral neck. And then you measure the angles between the joint line and your anatomical angles. And then you see you have different anatomical angles, which you should know, because it's very important then later on for cases where you plan to do an osteotomy, for example. So a very important angle is this medial proximal tibia angle. So the average is 87. So we don't have a 90 in nature. In total knee arthroplasty, we aim for 90, but from the nature side, we have an 87 as a general number. Of course, we have individuals with 90 and some others with 85 or 80, low 80s. But if you have low 80s, then you're not in this physiological range. So the physiological range is between this 85 and 90. So if you see a patient here with a 80 or maybe a 95, then you definitely know that on this proximal tibia angle, something is wrong. And the same needs to be done also for the distal femur. So you measure the lateral distal femoral angle. And again, you have an average that is 81, and you have a range, which is physiological between 79 and 83. And everything outside that range is pathologic and maybe is a reason for this OA in a patient. Also quite important is the long leg lateral view. We don't do it standardized, but in cases where we want to do an osteotomy, we definitely do it. What you see nicely here, that all the knees have a flexion between the femoral condyle and the shaft axis. So that's an 83 in average. That means a flexion of around 7 in a range between 79 and 87. And that's your posterior slope. So that's the angle between the tibia surface and the axis from the tibia, which is physiologic around this 9. In some individuals, 13, in others only 6 degrees. So these are some numbers. I think repeat those numbers to learn, but they are very important to make a good planning later on for your decision.